Hello, my name is Jillian Reese, and I am doing the Human Development 110 final project. All right, so my major is Human Development and Family Studies, pre nursing, and I'm also pushing a minor in psychology. And for the sake of this presentation, I'm going to be focusing on the psychology minor since human development is my major, and we could go into anything on that. So the first stage I chose was the prenatal stage. The prenatal stage is the process of the period from formation from an embryo through the development of a fetus to birth. There are three major stages, which is the germinal, embryonic, and fetal. The theory I chose was understanding the psychosocial needs of expectant mothers and supporting the transition to parenthood. How can nurses help? Nurses can help by addressing the postpartum adjustment, helping mothers adjust physically and mentally, and offering plenty of resources. The psychological aspect is talking a lot about postpartum depression, which affects a lot of parents, especially new parents. Another thing to focus on is the anxiety and stress for new parents. This can be leading up to birth and even after birth. There's a thing called dissociation, which is when mothers give birth and they don't realize that it actually happened and they now have a child. And the types of nurses that could help is a nurse midwife, and an OB nurse. There are also labor and delivery nurses and neonatal nurses. And I'm going to move, if I can try to move this. Okay, you might not be able to see it, but this is a image showing um, the weeks and the development of a fetus. Here's some pictures of some of the types of nurses. There are the nurses that are working with the pregnant women and during birth and post birth. So, yeah. The second stage I chose was the death and dying stage. What is the death and dying stage? The death and dying stage in human development refers to the final phase of life characterized by the decline of physical and mental functions preceding death. The theory I chose was the Erikson psychosocial theory, which I chose integrity versus ego despair, which is the positive reflection on life versus regrets of not having a fulfilling life, unresolved problems, and goals that may have not been met. Um, Another major thing in this stage is the 5 stages of grief, which I will be showing in the next slide. Um, and a psychological aspect is that nurses can display empathy and show support for patients along with the patient's family and friends who may be experiencing grief. Another big thing for nurses is to encourage life review, which can be storytelling and reminiscing over the positive moments in their life. And types of nurses can be hospice nurses and palliative care nurses. And here is the 5 stages of grief. So there's denial, anger, bargaining, depression, and acceptance. And these images kind of represent and show what grief may look like. Grief is different for every person, but um, most people experience at least one of these stages. The third stage I chose was the early childhood stage. Um, and what is the early childhood stage? It's the stage from infancy to about 6 years old, marked by rapid physical, cognitive, and emotional growth. The theory I chose is Erikson's psychosocial theory, autonomy versus shame and doubt. Shame and doubt occurs between 1 and 3 years, and toddlers who are encouraged to explore and do things on their own will develop those, whereas overly restricted will feel shame and doubt, leading to a lack of independence and confidence. The major psychological aspect is talking to children in the way they can understand, especially in healthcare setting. Going to the doctor might be scary for them, so really getting down on their level and um, relating to them, maybe talking to them about their interests and what they like to do. And also knowing the importance of social interactions, emotional changes, and there can be many sensitive periods. A phrase that was often used in my family was the terrible twos, because 2-year-olds go through a lot of big emotional changes. And the types of nurses are obviously pediatric, but the cool thing is that pediatric can be in any subspecialty. There's pediatric oncology nurses, pediatric, um, pretty much anything doctors or nurses, excuse me. Um, and yeah, and this is a visual I chose. It shows like the importance of routines, activities, and communities, and the bonds their parents or caregivers and teachers in an educational setting. But yeah, and a wrap up. So obviously, I have no idea what nurse I want to be, but seeing these 3 theories really shows into how this course um, affects any type of nurse and whatever you choose to do. So we have the neonatal um, pregnancy OB nurse, a hospice nurse, and a pediatric nurse, which really will correlate to uh, the 3 stages I talked about in this presentation.